Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about vitamin B2, or riboflavin. Riboflavin is a vitamin B that very rarely has a deficiency. In the developing world, it very, very rarely happens because we're getting enough in our diets and enough in everything we're taking into our body. However, in the developing countries, mild deficiency can be seen in as much as 50% of the population. Riboflavin deficiency is either primary or secondary. Primary deficiency comes because of inadequate dietary intake, where secondary deficiency is usually because of chronic diarrhea conditions. Could be malabsorption type situations like a gluten intolerance, celiac disease, inflammatory bowel disease. Chronic liver disease can actually be a cause. Dialysis can actually lead to it. Long-term use of barbiturates and chronic alcohol. So the interesting thing is some of the causes of peripheral neuropathy, like alcoholism or chronic liver disease, may actually be a partially caused by a secondary riboflavin deficiency. So what are the symptoms? What are you going to see typically with a riboflavin deficiency? The easiest thing will be chapping or fissuring the lips, but they're also finding that you can get a peripheral neuropathy or a central nervous system disorder. We're seeing actually in some of the studies, they're actually showing that you can actually get a reversible neurodegenerative disease in the brain that if you add back with the riboflavin, and a lot of times it's done with multiple other B vitamins because they're also usually deficient, then they will actually get resolution. So what type of peripheral neuropathy would this cause? Of course, deficiency neuropathy, but how does it affect it? The most common is a demyelinating peripheral neuropathy, where actually the myelin sheath or the lining of that nerve will actually start to fail, and you'll actually get problems with that because of lack of riboflavin in the diet. So how is it treated? We kind of talked about this a little bit, but number one is adjusting dietary intake so you're getting more of it in the types of foods that you're eating and so forth. But you can also add it as a supplement if that's the best route to get it into your system. So riboflavin deficiency, although it is quite rare as a cause of peripheral neuropathy, is something that all should be considered and should be looked at. This is Dr. Brandt Gibson, and this is your Neuropathy Nugget, day 140, vitamin B2.